Chapter 7. Neoplasia. Condition: papilloma, caused by the low-risk human papillomavirus. Its occurrence is equal in male and female. Its location is on the soft palate and the tongue, and the clinical features include an exophytic finger-like projection. The treatment is surgical excision, and the diagnostic process is microscopic. Epithelial dysplasia. It's pre-malignant, and smoking is considered a risk factor. It occurs in adults, and it occurs on the floor of the mouth and the tongue. Clinically, it looks like white erythematous or mixed white and erythematic mucosal lesions. The treatment is surgical, and the diagnostic process is microscopic. Squamous cell carcinoma. Cause: neoplastic. Occurs in males more than females and typically over the age of 40. The location is most common on the floor of the mouth, the tongues, and the lip, and the clinical features include an exophytic mass, ulcerated leukoplakia, and urethroplakia. Treatment is a surgical excision, radiation therapy, and chemotherapy, and the diagnosis is microscopic. Verrucous carcinoma. Cause: neoplastic. Occurs over the age of 55, more prevalent in male than female. Most common sites include the vestibule, the buccal mucosa, and clinically it appears as a slow-growing exophytic mass and papillary projections. The treatment is surgical, and it can be diagnosed microscopically. Basal cell carcinoma. Cause: neoplastic and associated with sun exposure. It occurs over the age of 40, equally in male and female, and is more prevalent in white people. The location is the skin of the face, and clinically it appears as a non-healing ulcer with rolled borders. It can be treated surgically and with radiation therapy, and it's diagnosed microscopically. Pleomorphic adenoma. Cause: neoplastic, occurs over the age of 40, more prevalent in females than in males. The location is the parotid gland. Most common intraoral sites are the palate. Clinically, a non-ulcerated dome-shaped lesion is occurring. The treatment is surgical, and it can be diagnosed microscopically. Mucoepidermoid carcinoma. Cause is neoplastic, occurring more in female than in males. The location is the parotid gland, but it can also be found on the palate, and some are central to the mandible. Clinically, it's asymptomatic with swelling or mass present, and radiographically, a unilocular or multilocular radiolucency can be seen in the bone. The treatment is surgical, and the diagnosis process is microscopic. Adenoid cystic carcinoma. Cause is neoplastic, occurs more in female than in males, and it happens in adults. The parotid gland is the most common site, but in the mouth it is the palate. Clinical features include a mass, often painful. Surface may be ulcerated. Surgical excision or radiation therapy is the treatment, and the diagnostic process is microscopic. Ameloblastoma. Cause: neoplastic, occurring equally between male and female, and occurring in adults. It's found in bone. Peripheral tumors also may occur. It occurs more often in the mandible than the maxilla, and it occurs more posterior than anterior. Clinically, it appears as a slow-growing expansion of the bone. Radiographically, a unilocular or multilocular radiolucency can be seen. Treatment includes surgical excision, and diagnostic process includes microscopic. Calcifying epithelio-odontogenic tumor. Cause: neoplastic, occurs equally between male and female, and it occurs in adults. The posterior mandible is the location. Clinical features include asymptomatic, slow-growing expansion of the bone. Radiographically, a unilocular or multilocular radiolucency with scattered calcifications can be seen. Treatment is surgical excision, and it can be diagnosed microscopically. Adenomatoid odontogenic tumor. Cause: neoplastic. Age: 70% occur under the age of 20, and it occurs more in female than in males. 70% involve anterior maxilla or mandible, and it occurs more in the maxilla than the mandible. Clinically, an asymptomatic swelling can be seen, and radiographically, a well-defined radiolucency associated with an impacted tooth and radiopacities within the radiolucencies. Surgical excision is the treatment, and it can be diagnosed microscopically. Calcifying odontogenic cyst. Cause: a cyst with neoplastic variants. Age: under the age of 40, and occurs equally between male and female. It's found on the maxilla and the mandible, and clinically it appears as an asymptomatic swelling and root absorption or resorption. Radiographically, unilocular or multilocular radiolucencies can be seen and radiopacities within the radiolucency. Um, Treatment includes enucleation, and the diagnostic process is microscopic. Odontogenic myxoma. Neoplastic is the cause. It occurs between the ages of 10 and 29 and equally between male and female. It occurs more in the mandible than the maxilla. It's asymptomatic and it clinically appears as an expansion of the bone. Radiographically, a multilocular honeycombed radiolucency can be seen. Treatment is surgical excision and diagnosis is microscopic. Benign cementoblastoma. Cause, neoplastic. Age, younger than the age of 25, and it occurs equally between male and female alike. The location is mostly occurring in association with the mandibular molars, and clinically can be seen as localized expansion, pain, and vital teeth. Radiographically, a well-defined radiopaque mass in continuity with the roots of the affected teeth. The treatment includes enucleation of the tumor and removal of the associated tooth, and it can be diagnosed microscopically and radiographically. Amelioblastic fibroma. Cause, neoplastic. Age, younger than the age of 20, and occurs more in male than it does female. It occurs in the most posterior mandible. Clinically, it appears as an asymptomatic swelling. Radiographically, it's a well-defined unilocular or multilocular radiolucency. The treatment is surgical, and the diagnosis is microscopic. Amelioblastic fibroodontoma. Neoplastic, the age is 10 and younger, and the location is the posterior maxilla or mandible. It's an asymptomatic swelling, and radiographically it can be seen as a well-defined radiolucency with associated calcification. The calcification may resemble teeth. Treatment includes surgical excision, and it can be diagnosed microscopically. Odontoma. Cause is neoplastic. It occurs in children and young adults. It's most commonly located on the anterior maxilla and posterior mandible. It's a lack of eruption, and there's some swelling involved clinically. Radiographically, compound is a cluster of miniature teeth, and a complex is a radiopaque mass. Its surgical excision is a treatment, and it can be diagnosed radiographically and microscopically. Peripheral ossifying fibroma. It's probably reactive. It occurs in children and young adults. It occurs more in female than it does male. The location is the gingiva. A nodular, sessile, or pedunculated mass is present, and the treatment is surgical excision and scaling of the teeth, and it can be diagnosed clinically and microscopically. Lymphoma. Cause, neoplastic. Age, mostly over the age of 40, most commonly found in the intraoral, buccal, mucosa, or vestibule locations. The clinical features include a yellowish mass with dedicated patterns of blood vessels on the surface. The treatment is surgical, and the diagnosis is microscopic. Neurofibroma schwannoma. Cause is neoplastic. It occurs at any age, between both genders equally. Most common intraoral location is the tongue. It's an asymptomatic nodule clinically, and it can be removed surgically and is diagnosed microscopically. Granular cell tumor. Cause, neoplastic. Age, between the ages of 30 and 50, occurs more in female than it does male. The most common locations are the tongue, buccal, mucosa. Asymptomatic nodules can be seen clinically. Its surgical excision is the treatment, and the diagnosis is microscopic. Congenital epilepsy. Cause, neoplastic. Present at birth, occurring more in female than it does male. The location is the anterior maxillary gingiva. Clinically, it appears as a sessile or pedunculated mass. Surgical excision is the treatment, and the diagnosis process is microscopic. Rhabdomyocarcinoma. Cause, neoplastic. Frequently younger than 10 years old, occurring more in male than it does female, and the location is the head and the neck. Clinically, it can be seen as a rapidly growing destructive tumor. The treatment is surgical excision, multi-agent chemotherapy, and radiation, and the diagnosis is microscopic. Hemangioma. Congenital development in adults' response to trauma is the cause. It occurs in adults and is congenital, occurring more in female than it does male. The most common oral site is the tongue. Clinically, it appears as a deep red to blue mass blanched with pressure. The treatment is injection of sclerosing solution and spontaneous remission, and the diagnosis is clinical and microscopic. Lymphangioma. The cause, neoplastic development. It occurs congenitally. The location is the tongue. Clinical features include an ill-defined mass with a pebbly surface. Microscopically, the lesion is composed of lymphatic vessels. The treatment is surgical, and the diagnosis is microscopic and clinical. Kaposi sarcoma, cause neoplastic, and also the human herpes virus 8 occurs more in male than it does female, and the most common oral site is the hard palate in the gingiva. Clinically, purple macules, plaques, or exphatic tumors can occur. The treatment is surgical excision, radiation, and chemotherapy, and it can be diagnosed clinically and microscopically. Melanocytic nevi, cause developmental, age 20 to 50 years old, occurring more in female than it does male. The most common oral site is the hard palate and the buccal mucosa. Clinically, it appears as a tan and brown macule or papules. The treatment is surgical, and the diagnosis is clinical and microscopic. Malignant melanoma, cause is neoplastic. It occurs over the age of 40 years old. The location most commonly is on the hard palate and maxillary arch. The clinical features include a rapid enlarging blue and black mass. Microscopically, it's a malignant tumor, and the treatment is surgical, and the diagnosis is microscopic. Osteosarcoma, cause neoplastic. Most common primary malignant tumor of bone in patients younger than the age of 40, occurring more in males than it does female. Twice as frequent in the mandible as it is the maxilla. It's a painful diffuse swelling or mass expansion involving bone. Radiographically, destructive, poor defined radiolucency and radiopacity, asymmetric widening of the periodontal ligament space, and a sunburst pattern. The treatment is surgical and also chemotherapy, and the diagnosis process is microscopic. Chondrosarcoma, cause neoplastic, occurring more in males than it does female, and occurs on the maxilla and the mandible. Enlargement of the bone can be seen clinically, and the treatment is a wide surgical excision, and the diagnosis is microscopic. Leukemia, cause neoplastic, occurs more in male than it does female, and the location is on the gingiva. Clinical features include diffuse gingival enlargement with persistent bleeding. Microscopically, atypical white blood cells and circulating blood tissue. Treatment is chemotherapy, radiation, and corticosteroids. It can be diagnosed in the laboratory and also microscopically. Lymphoma, cause neoplastic, occurs more in male than it does female, and is more prevalent in adults. The most common oral sites are the tonsils. Enlargement of the involved tissue can be seen clinically. The treatment is radiation and chemotherapy, and it can be diagnosed microscopically and in the laboratory. Multiple myeloma, cause neoplastic, it occurs in adults, more prevalent in male than it is female, and it occurs more in the mandible than it does the maxillary. Clinically, it can be seen as a bone pain and swelling. Radiographically, multiple radiolucent lesions can be seen. The treatment is chemotherapy, and the diagnosis is in the laboratory, also microscopic. Metastatic tumors, cause neoplastic. It occurs more in male than it does female, and especially in adults. It occurs more in the mandible than it does the maxilla. Clinical features include pain, paresthesia, swelling, and expansion of the bone. Radiographically, variable but usually poor defined radiolucencies can be seen. The tooth roots may show spiked appearances, and some may appear radiopaque. The treatment is chemo and radiation, and it can be diagnosed microscopically.